Thank you all for being here today, and thank you for all these dedicated men and women behind me being here. I really appreciate the support. So, good morning. I'm Representative Rebecca Raymer, and I'm here to talk to you about my new legislation, House Bill 447, an act relating to coverage for emergency ground ambulance services. I'm a registered nurse, and making sure Kentuckians have access to high quality, timely care is one of my top priorities. Right now, inadequate reimbursement for ground ambulance services have pushed Kentucky's EMS system into crisis. In some counties, there is only one ambulance available to serve the entire community. Reimbursement rates have not kept pace with rising operational costs, forcing many ambulance providers to scale back services or shut down completely. Today, 91.7% of Kentucky counties are considered ambulance deserts, meaning residents are more than 25 minutes away from timely emergency medical response. Over the interim, I met with ambulance providers and EMS professionals from across the Commonwealth to better understand the depth of this crisis. These dedicated men and women are doing everything they can with extremely limited resources. But our EMS system is on the verge of collapse. What I learned was troubling. On average, insurance companies in Kentucky reimburse less than half of what an ambulance services bill. In some counties, reimbursement drops to less than 10%. When I saw those numbers, I knew action was necessary, which is why I filed this common sense legislation to modernize reimbursement rates. Ground ambulance reimbursement has not been updated in more than 20 years, and insurance companies have taken full advantage of that outdated system. To put this in perspective, in Boyle County, insurance reimbursement is just 36.7% of bill charges. Fayette County, 38.4%. Hopkins County is slightly higher at 42.7. Nelson County, reimbursement falls to just 10.7%. Muhlenberg County, 27.4%. Perry, 23.9%, and Laurel County, only 9%. Additional county data is still being collected, but what we already know makes one thing clear. This situation is unsustainable. Patients are being put at risk when ambulance services are limited, and when reimbursement falls short, someone has to cover the gap. And too often, that burden falls on the local taxpayer. Instead of paying the bills they are sent, insurance companies step aside while county governments, like Lewis County, that's represented today here by Judge George Sparks, are forced to find ways to cover the cost. In many cases, the only option are raising local taxes or losing ambulance services altogether. In a moment, you'll hear from Judge Sparks, who is also a paramedic, along with Jim Duke, John Holder, and Mayor Bruce Fraley of Berea. I'll close with this. I filed House Bill 447 to ensure that every Kentuckian has access to stable, reliable emergency care without shifting additional costs onto the taxpayer. This is common sense reform. It will save lives, and I hope my colleagues will join me in co-sponsoring House Bill 447. Thank you.
Representative Raymer, thank you, ma'am. I appreciate the invitation and the opportunity to provide a little perspective on the health of EMS across the state. My name is John Holder. I currently serve on the Kentucky Board of EMS, and we're the regulatory body for pre-hospital care here in Kentucky, and we have a unique opportunity to see the diverse EMS services across the state as a whole. And as you just heard, reimbursement is a little bit of an issue. The EMS directors, those fantastic men and women out there, have literally for years been holding the line. They've been squeezing their budgets and making ends meet. And unfortunately, from a board level, we're starting to see some of these services beginning to break. Things are getting untenable. As you just heard, the cost of running some of these ambulance calls, reimbursement doesn't cover it. A first-year economics student can tell you that's not a very tenable position to be in. And unfortunately, these ambulance services are doing the best they can to make ends meet, and it's just not working. Lately at the board, we've been getting phone calls from directors who ask us to help them through the process, for instance, of borrowing an ambulance from a neighboring county or a neighboring service. And they have to borrow these ambulances because there's no money to replace their aging ambulance fleets. Mileages are going up, ages on the ambulances are going up, and at times the majority or sometimes all of their ambulance fleets are broken down, and they have to borrow ambulances from their neighbors just to be able to make runs in their community. And it's not good. It's not good. On top of that, the equipment in those ambulances is aging. The cost of a monitor nowadays, a cardiac monitor, maybe $50,000 or $60,000 for the newest one. And some of our services can't afford to do that, so they're keeping equipment online longer and longer, longer than they should be. Um, I had the privilege yesterday of making some ambulance runs out in the field with some wonderful crews. We went on an emergency run together and walked in the house, and someone said, "Oh no, did you have to knock the dust off that thing to bring it here?" And I looked over, and it was an older cardiac monitor they were carrying. And afterward, I talked to the crews, and it hurt them. You know, they're doing the best they can with what they got, but it hurt them. And these folks out here that are doing an amazing job, that's probably the worst part is what's happening to the personnel out there. This very morning, across the Commonwealth of Kentucky, there were untold numbers of paramedics who clocked out from a hard shift, drove to the town next door, and clocked in to work a back-to-back shift. And they had to do that for a couple of reasons. One, the wages they're getting aren't enough to pay their bills. They have to work 2 jobs. But also, if they don't go to the town next door and clock in, that town doesn't have a paramedic. And those services aren't meeting their minimum staffing requirements if they don't go and do that. We've got services, 5 or 6 services sharing, the same paramedics. There's not enough out there. It, it it's tough. It's tough, but at the end of the day, if there's no reimbursement and there's no money to pay these folks, what they're worth to do the hard job that they're doing, it's harder to recruit those folks and definitely harder to retain those folks. So we're wearing them out, and it's hard to see because they really are doing a wonderful job with what they've got, but they need some help. And I mean, who helps the helpers? Who responds to the responders? And as you've seen, it's our elected state representatives like Rebecca Raymer. I can't tell you how grateful we are for her taking up the mantle of this problem and trying to help our EMS services to make ends meet a little better. So thank you all very much. I appreciate the time.
Representative Raymer and distinguished senators and representatives and all my uh, colleagues here. Thank you all very much, and the guest as well. And I appreciate the opportunity to be here in Frankfort today to speak on behalf of EMS. And I want to speak here on my strong support of House Bill 447. It addresses a crisis that is affecting communities all across the state, especially rural communities, and one that Lewis County has experienced firsthand. In 2022, we had a private ambulance service in Lewis County, and they came and said, "We are closing our local station and leaving out of the county." And the reason for them to do it, for doing that was simple. They were losing money in the county, and they could no longer afford to stay there. So overnight, Lewis County faced a crisis. Are we going to have an ambulance service or not? Or in a dependable service? And so this affects counties all across the state. And it was a very uncomfortable situation. But what we did, they told us that with low call volumes, long transport distances, staffing shortages, the increased in fuel costs and equipment costs had just, and the low money that they got coming in from their billing services. They were either denied or not paid at all. And then sometimes, like Representative Raymer said, they pay the patient, and the ambulance service is left trying to get that funding back. So it's a very tough situation. So I'm sorry, I'm a little bit nervous with all you people up here looking at me. But anyway, we were faced to either subsidize, and that's what we did. We used our ARPA funds to subsidize and keep the ambulance service there for a period of time, and the city of Vanceburg also helped us subsidize that. But we were faced, are we going to continue to do this with money that we didn't really have? Or are we going to start our own ambulance service? And that's what we decided to do. So we did create an ambulance service district in Lewis County, and it was a great decision, but still yet, it was very expensive and a hard situation. Both are not inexpensive, and it took a lot of hard work and time to start an ambulance service. There's a lot of uh, complicated pieces to that. And we went, they kept increasing the money that they wanted us to pay them to the point that we just could not do that. So I knew when we created the service district that we had a little bit of money, and they kept increasing how much they wanted. And I thought, if we keep on paying them what they're asking, we're not going to have any money to start our service. So we cut the contract with them, and we did not have an ambulance service in Lewis County for 2 months. And I'm telling you, it was one of the most stressful times that I've ever had in my life, is because our dispatchers were stressed when they answered the phone. Somebody called having a heart attack, and they could not promise that they were going to have an ambulance there. And if we couldn't get mutual aid from one of our surrounding counties, and we have some great counties all the way around us that helped us out, but guess whose phone rang? In the middle of the night. I took a lot of them to the hospital because I am a retired paramedic firefighter, and I took them in my work vehicle and dropped them off in the ER. They were kind of surprised, but I thought, you got to do what you got to do. So on May the 31st, 2024, we opened Lewis County EMS. And wow, I put a lot of pressure. We have our EMS director, Michael Bible, here with us today, and he's done an incredible job, and I appreciate that. And our emergency management director, Dennis Brown, here. And we had a great team that worked together. We didn't always see eye to eye, but we worked and walked hand in hand, and we made it through. It was a real challenge to get a certificate of need. They even held that over us and wouldn't turn it over to us, so we had to do it the hard way to get our own. But that was the first year. They started May 31st, 2024, and the first year they did 1,596 runs. So you can tell how important that was. And in 2025, they did just under 2,000 ambulance runs. So we are so thankful to have them. But I do think the time to fix something is before it's broke. And I want to support this because I would like to see our ambulance services thrive. I know there's other counties across the state, and I've talked to some of the county judges, and they say, well, what are we going to do? We're struggling with EMS. And I said, I'll tell you our story, and I'll help you any way I can. But a lot of it is connected to, like they said here, a heart monitor, $50,000, a stretcher, $30,000 to $35,000, a CPR machine, $20,000, and the contracts to do the maintenance on them can be $2,000 to $10,000. So you can get them replaced within 24, 48 hours. And that's so important, isn't it? But many counties don't have the resources, and I feel sorry for a county that doesn't have an ambulance service. And that's why I really appreciate Representative Raymer for taking this up. She's a nurse, and so I know she knows in the hospitals. We don't have a hospital. We don't have a trauma center, emergency room, and our transports take us out of the county for 90 minutes a lot of the times. So it's tough, but I want to encourage you to support this House bill because we want to see EMS all across Kentucky, not just in the big cities, but those people out in the rural communities, they deserve to have an ambulance come and get them when they're having a heart attack. I mean, you can imagine, I was thinking on the way up here today, you never know when a medical emergency is going to occur. And if you know that you can pick up the phone and help is going to come, you can't really put a price on that. We had a few people that complained about us starting our ambulance service district, but once we got started, I've heard probably less than 5% of the people hardly ever get a complaint, but all compliments. We're so thankful. So thank you all for all you do every day. And you probably don't get thanked very often, but it's a wonderful thing to be a paramedic or an EMT and to help people when they need help the most. So I appreciate your time and the opportunity today. Thank you all very much.
Slide them get.
Good morning, everyone. Bruce Raley, Mayor of the City of Berea. I want to begin by thanking Representative Raymer for filing House Bill 447. As mayor of the city of Berea and first vice president of the Kentucky League of Cities, we are proud to speak in support of this bill. House Bill 447 is a solution that strengthens emergency services, protects residents, and brings greater stability to city finances. The flexibility matters because communities across Kentucky have different emergency service models and different cost structures. These decisions are best made locally by leaders who know their communities. As mayor, I hear firsthand how medical expenses can place a real strain on Kentucky families, especially in moments of emergency when residents don't have a choice about who responds or what it costs. House Bill 447 helps protect residents from unexpected, costly ambulance bills, improves predictability for patients, and does so without shifting the financial burden back on cities or taxpayers. On behalf of Kentucky cities, we recognize the importance of sustainable EMS funding, and this bill provides a responsible framework that works for all local government, first responders, and the people who rely on them in their moment of crisis. Thank you again for your time, and I would join the judge in thanking all of the emergency responders that are here and represented today, and all those across the Commonwealth for the good work that they do every day. Thank you.
Hello, my name's Jim Duke. I'm a paramedic from Ohio County, and I represent the Kentucky Ambulance Providers Association. CAPA, the Kentucky Ambulance Providers Association, represents over 120 EMS services, both rural and urban, across the state of Kentucky. I'd like to start out by thanking Representative Raymer for her passion on healthcare and also on her willingness to look for common sense ways to fix problems. We really appreciate that. We are in a crisis, and when Representative Raymer talked about deserts, EMS deserts across the state, we do have deserts, but we also have droughts. And when I say a drought, what I'm talking about is counties, services, communities that have an ambulance service, but they aren't able financially to have the amount of EMS coverage that they need. You can have a county with 2,000 or 3,000 people. Maybe they can barely afford to have one ambulance around the clock. Well, these small counties have to transport patients a lot of times out of the county to a bigger hospital for people that have heart attacks, strokes, so forth. What happens when that ambulance is gone? There's no coverage. That county needs 2 trucks. Maybe they need a truck and a half. Maybe they need a day truck and a 24-hour truck. They're not able to afford that because currently we are subsidizing commercial insurance payments. And how are we doing that? With a tax. We're taxing people. We're taxing people for their special tax districts. It could be general fund that you're shifting money from your county budget that would otherwise be going for other programs to subsidize commercial insurance payments. When we have a call, when it's a 911 call, we don't ask a person if they have insurance or what kind of insurance they have. We take care of them. If we have a patient sitting in a small hospital and they need to be transported to Lexington or Louisville, we don't ask what kind of insurance do they have. We take them because that's what we're here to do. That's what our mission is. But somebody's got to pay the bill for that. And right now, 50, 60, 70, 80% of that bill is being paid by local government taxes, offsetting the cost so that the commercial insurance companies can keep more of their money and post higher profits. All we're asking is that our costs are met, that we're not having to subsidize these large commercial insurances, and that people don't have to worry about how they're going to pay a bill when they have one of the worst events of their life happen. I'd like to open it for questions if there's anything at this time.
What's an example of the situation you've been in where you've seen the result of not having the money to rise to a case?
Typically, the worst case scenario is where a county just can no longer afford to have an ambulance service, and they're depending on surrounding communities, if they're not too busy, to help them. You know, where a person's having a heart attack and there's really nobody that's assigned to take care of that call. There's nobody there. They're just having to ask. You'll call the next county and say, do you have to happen to have an extra truck? Well, no, we've got one truck and it's on a run. Well, thanks. I'll try somebody else. I don't want to be that person that's having a heart attack and the dispatcher's calling around trying to find, like you're trying to find somebody to work on your air conditioner. You know, you call and they tell you they'll come, but they don't. You need to know somebody's coming.
So we've heard about a lot of different kind of issues. So there's the staffing, wages issues, and the equipment. Can you talk a little bit about, will the reimbursement legislation address all of those issues? Is there another piece that's needed later?
Well, we work at the national level with Medicare and at the state and national level with Medicaid. What we can do right now in Kentucky is address this commercial insurance problem. You see this equipment here, you're probably talking $100,000 worth of equipment. A service can either purchase this equipment for their county, or if you're the size of Lewis County, you can subsidize Anthem for another 3 months. One or the other, but you can't do both. And right now they're having to subsidize.
This one might be best for Raymer over here. But do you see the insurance companies as just raising prices and premiums as a result of this legislation? Is that a concern of yours at all, or do you think this addresses it in some way?
I think anytime you look at a type of mandate, that's a worry that you have. But when you look at for commercial payers, the piece that they pay for EMS transport is very minimal. So when there's been a study to look to see what that cost may be, and honestly, it would be a very minimal cost, we believe.
0.3% of the expenditures of a commercial insurance company go to provide reimbursement for EMS emergency transport. 0.3%. So let's say it doubles. So their cost is going to increase by 0.3%.
Whereas the taxes could be higher.
Oh, absolutely. When you're 0.3% is their total cost. When's the last year that your insurance, your health insurance, didn't go up anyway? It's going to go up whether we do this or not. Taxes is not the way to solve this problem. Taxing the taxpayers, the people of Kentucky, is not the way to solve a problem that it comes down to just not reimbursing what they should reimburse at the commercial level.
Can you talk a little bit about how you measure success? What time range you're looking at? Like, are you thinking in 2 years I want to see this many more ambulances, or for example?
Well, the first way I would measure success is getting this bill across the finish line, and our providers here getting the reimbursement that they need. And it truly is a necessity. It's not a want. They need this. And yes, I think that if we see that reimbursement be where they can sustain, success would be not seeing ambulances shut down or having to go down to less trucks in an area. So yes, every county having an EMS and being able to respond in a timely manner to their calls. We're still having those conversations. I think everybody acknowledges there is an issue. There's a problem here that needs to be addressed. So those conversations are still ongoing.
On the overworking point that you talked about with people, maybe thermally going to other counties for, can you sort of talk about how that shows up on the patient side? I mean, if you have medical professionals who have to be stretched so thin, how does that translate with patients?
I would compare it to if you were a nurse and you went into the emergency department and the nurse that's taking care of you is on her first 12-hour shift, or she's worked 3 in a row. You know, you're dealing with people that are stretched to the breaking point. And the trick is we need more of those people in the field. Whereas in Representative Raymer's county, she needs another ambulance around the clock. That would ease the tension. We have to go through the training. We have to get these people out there. But ultimately, those communities need more staffing so that they can make the runs. Instead of a crew making 12 or 15 runs in a 24-hour period, they're making less than that. And the people are getting to the calls quicker when you have more ambulances on staff.
What about the professionals themselves? Like, how does that affect their mental and physical health?
You see burnout, you see PTSD, you see more illnesses, more time having to take off for just being wore out.
Representative, health insurance companies often have large lobbying budgets. And how do you combat, maybe their opposition to this? What's your pitch to your colleagues here in the legislature? And what's your pitch to Itatians?
My pitch is that it's a necessity. It's not a want. And the men and women standing behind me today is how I would convey this to my colleagues in the House, is that every one of their counties is affected by this. It's not just isolated to one area of the state. This is a statewide problem. It's real problem, and it affects everybody. When you don't think about EMSs until you are the one on the other side of that phone and you need them to come for you or your family member. And then when you experience that and there's a delay, you're going to understand what an issue this is. So my goal would be that nobody ever feels that. Nobody ever picks up the phone and calls 911 and is told there is nobody to come. So we're trying to stop that problem. And those are the real conversations that I have with my colleagues.
Are you hearing any opposition now?
There is opposition, of course. Like you said, I mean, insurance companies, of course, they're going to have an issue with setting reimbursement rates. I understand their concerns, but I think that the issue that we're trying to combat is grave. And I think we're at the point that we have to do something. A lot of, we have these little small local EMSs that just don't have they don't have the leverage to negotiate like a large health company. So when they can't get that done, it becomes our responsibility to step in and make sure the service is provided for our Commonwealth.
To add to that, when an EMS service now reaches out to commercial insurance and says, we want to negotiate a better rate, there is no incentive for that insurance company to negotiate. We're going to do the care anyway. They know that. They could pay us $1 and we're going to continue to provide the care because we have to. There's no other healthcare method that I'm aware of, and I'm a nurse and have been in the healthcare field my whole life, where there's a healthcare entity that can survive on 10% of the cost of providing the care.